This Guy's Garage. Like and subscribe.
In your opening statement, you talked about construction workers. I'm glad there was a mention of that. You then talked about different policies to address gaps in the workforce. The one I didn't hear you mention was healthcare and addressing the shortages in healthcare we're hearing stories from across the country of doctors who are from the United Kingdom, they're from South Africa and other countries with comparable training, waiting for permanent residency. So the case I wanted to bring up is an Ottawa area doctor, Dr. Carmen, I'm going to say Bilchea, who applied for permanent residency and was rejected by your department. Why is that? Have you seen the story?
Minister Miller.
And you can't really comment.
It's both imprudent and bad policy to comment on individual cases. I do understand that the individual applied under the express entry draw. I don't think the conclusion is that that person is excluded from permanent residency. That is all that I can speak to publicly about it, but it is clear that in the context of healthcare workers, of which since we spoke or since the summer we've drawn in 2,000, which I think is important, there's definitely a need for doctors.
Here, but Chair, she has gone public. It's in the news. There's an article, CTV News Ottawa, they're reporting on this. In her particular case, she came to Canada in 2021 from the United Kingdom. She works at Meadowlands Family Health Centre. 1,200 patients are depending on her for health services. And you're telling me you're not going to comment on this story. Has anyone in your office reached out to her?
Honourable Minister.
So again, there are pieces of information I am not at liberty to speak to you about. What I am at liberty to speak to you about is her permit, which allows her to practice till 2028. I think you know that we are quite strict and stringent about the level of information that we do share with the public. Even if someone does go public, it does not correspondingly mean that the Minister of Immigration, Refugees and Citizenship can speak publicly and broadly about the details and the merits of the case. I can say quite clearly that we absolutely do need doctors in this country, whether they're homegrown or brought in from abroad.
So in the same article, the doctor says she will have to return to the UK in a little more than a year or risk losing her medical license that were there, where it has to be renewed yearly. So because of red tape, you're saying because of red tape, your office has not spoken to her, you've not reached out to her, nobody's spoken to her. This is a doctor with 1,200 patients. 1 in 5 Canadians, according to CMA, in a survey just early this summer, 1 in 5 Canadians don't have a family doctor. And a family doctor here is saying they're going to have to go back to their country of origin. You're saying, I'm sorry, bureaucratic red tape stops me from talking, doing anything, or helping this person attain permanent residency so 1,200 Canadians can keep having a family doctor.
Honourable Minister.
With all respect, I think you're making a lot of statements and drawing a lot of conclusions that aren't accurate. The one thing I can say to you is her case should not be prosecuted in front of this committee. I would also add that does not preclude us from having spoken to her, nor can you draw the conclusion that we haven't.
Honourable Member.
So, Minister, we're not prosecuting here anything. It's a story printed, CTV News Ottawa, published November 30th, that goes into the details. I'll quote her to you. It breaks my heart because I do understand how important it is for every single person to have a family doctor. She goes on, the entire immigration process in Canada is extremely lengthy, extremely torturous, is costly, and the outcome is uncertain. Do you agree with her?
Honourable Minister.
I agree that at times that is the case, but again, to speak to the individual facts of the case in front of this committee is untoward. It doesn't mean that we aren't deploying efforts to make sure that people do have family doctors in this country, and it is the focus of our department.
Honourable Member.
It's the job of members of Parliament to advocate for Canadians, and I see 1,200 patients of hers and this clinic who are going to lose a family doctor because you're telling me red tape, bureaucracy, I won't do it. Will you commit, Minister, to reaching out to her? Will you commit that one of your exempt staffers on your political staff will reach out to her to resolve this issue so that 1,200 Canadians can have a family doctor for Christmas?
Honourable Minister.
Something that I'm going to talk about publicly. If it gets done, you can draw your own conclusion, but again, what you're using the committee's time to do is to talk about a news article that I think is very compelling. Some of the conclusions actually do apply to some of the challenges we face as a department, but you're also asking me to talk about specifics and facts that exist within the department that would be utterly wrong to do in a public context.
Honourable member.
Well, let's make it generic then. If this happens again over the next 6 months, how will you react? Will you reach out to the doctors to make sure it doesn't happen again? You have occupational draws that are being made, and there are certain amount of spots being set aside for it. I would have thought a doctor who's already practicing in Canada would then be eligible to stay, and your department would make sure that they would get one of the very few permanent residency spots that are afforded to them. So in the future, just make it a generic case. When this happens again, will you reach out to them? Will you make sure that Canadians can keep the family doctors they have now and that those people will get permanent residency in Canada?
Minister, you have 30 seconds.
It's been quite clear both publicly and directly to my department that we should prioritize doctors. In the healthcare field, that we are deploying extraordinary efforts to attract people from abroad. It is critical to get doctors, and we need to make it easy for them. If that is a very important answer that I'd like to offer this committee, and I've kept it deliberately general to preserve important facts and information that we need to keep confidential.
Honourable member, you have 10 seconds.
In this particular case, Minister, you say you've directed the department to look at family doctors. It didn't happen in this case, and she had to go public. She went to a journalist, and it's all over the news right now.
Thank you. Honourable member, the time is up. Minister, you want to respond?
For what people put in the news, that is their choice, and issues like these are unfortunate when they arise in the public domain, and it is clear that we have to do a better job at making sure that we do attract and keep doctors in Canada to make sure that patients are well served.
Thank you, Minister.
Minister, officials, welcome. I'm going to go right into your supplementary estimates here, where you're asking us to give our input on $671 million of additional appropriations you want for this year. But in your past yearly estimates, your biggest increase in funding seems to come from professional and special services. $600 million spent in this area 3 years ago, a $1.4 billion last year. How much are you spending in professional and special services this year?
Honourable Minister.
Pass to the Deputy Minister.
Okay, Deputy.
So I think
Madam Hawks.
in terms of the SEPS-B, I think what I can say is we have sort of one element that's kind of the modernization of our platforms. And it's a modest one in terms of the SEPS-B. It's about $18 million. Some of that would be for kind of cloud technology, et cetera. I think that we always look at the balance of, outside external advice versus internal spend. I think in the area of IT, I think you have noted that in some years it has been high. I would agree with that, especially as we were sort of launching the digital modernization platform, looking at cloud technologies.
Thank you. I have limited time here.
Keep the answer brief,
Yeah.
please. Mr.
So the expected number for this year?
Minister.
We can get it to you.
Yeah.
Okay. I'll go on with the next
Natalie may
question.
have
No,
it,
she's got it. She's got it. We have it.
Go ahead, please. Mr. Muglenski, don't worry, I'll keep time here. Okay,
So the expected number for this fiscal year is 1.9 billion, but 70% of that is for passport delivery amounts that we transfer to ESDC, hotels.
Sorry, can we stop? You said 9.9 billion?
1.9.
1.9 billion. Thank you.
1.9
So
billion.
from 1.4 to 1.9, so another $500 million increase.
No, 70. Well, yes, but 70% of that is for it includes hotels and the interim federal help program, which have increased since last year.
So that includes the hotels where nobody was really staying half the time and they were excessively paid for?
Ms. Mansour.
Minister?
Minister.
I mean, if you look, I don't know what you're referring to, but if you look at the hotel occupancy rate across the IRCC network, it is well, Deputy Minister's telling me 95 to 98%.
Mr. Muglenski.
Can you provide us with the top 5 payers of those professional and special services, please? The payees, I'm sorry.
Honourable Minister.
I'm sure we could provide you a list.
We can have the full list later. That would be appropriate. Thank you.
Mr. Muglenski.
Okay. Starting in 23-24, the government announced $14.1 billion in spending reductions over 5 years. That's $14.1 billion. There'll be $500 million that's expected in cuts this year on consulting, other professional services, et cetera. And these reductions will be achieved by freezing the $500 million in the reference levels of organizations like yours for 2023-24. That's this year. And yet you've spent another $500 billion on top of your estimates on this. So are we going in the wrong direction, Minister, as far as your budget goes?
Honourable Minister.
I think across the system, we are looking at efficiencies. There is no question that in this department in particular, given the rise in the clientele, the historic demands, that we are seeing pressures that have nothing to do with our desire to be efficient in what we actually do, and as well look at attempts to rationalize how we do immigration in Canada. That was sort of the point and conclusion of the strategic immigration review.
Yeah, thank you, Minister. And but you continue to push these out. I mean, this is the department you're in charge of at this point in time. You continue to push these numbers out as if each year you're going to have a reduction, and every time you come back with more subs, that pushes you beyond what the last year's spending was. So there seems like there's a lack of foresight in the spending here. And I will note the full-time equivalents that you continue to show in your departmental plan includes a reduction of very minimal amounts of bodies, but very large amounts of funding that are being reduced in the future here. Is this a mirage, or are you actually putting some planning into this about how you're actually going to meet the needs of the department with the resources you have presented in the main estimates?
Honourable Minister, you have 20 seconds to respond. Madam Box.
Maybe just quickly, I can say that we have commitments to make and that we've made on professional services reductions, but I would just note that for the interim health benefit, if we have an increase in humanitarian and compassion arrivals, there will be, by definition, an increase in that spend in the context of people having access to the interim health benefit. So it's not like a cap, right? If people come in, they need the health benefit, it kicks in based on arrivals. So I would separate the interim health benefit to the consulting and kind of contracting that we would do, let's say, with IT professionals, and that we are demonstrating a reduction as early as this year, going into 26, 27, and beyond, as per the Budget 23 commitment. The organization has committed to the reduction.
Mr. Chair, earlier today I asked your Deputy Minister about the CAWID visa program, Minister. In the Yates report, it talked about only 10,000 was the original group of people the department thought would be allowed to stay as permanent residents. There are over 200,000 CAWID visa holders. What's the future hold for them? Can you commit to finding a path to permanent residency for these war refugees that have come to Canada?
Honourable Minister.
Look, I think we will have to have a discussion about what that pathway to permanent residency is for Ukrainians that wish to stay. Currently, the plan, and we have some geopolitical considerations, as you well know, with respect to the permanence of those people that are here. There are well over 200,000. There is, as you mentioned, a pathway for people seeking permanent residency, but the general expectation is that those people do return to rebuild Ukraine once the war is won. That is a reality. And it is one that is not without geopolitical consequences if we decide to expand permanent residency currently. There are pathways. Are they sufficient? I think time will tell. And there is a point where Canada will have to make additional considerations, but we aren't prepared as a country to do that now.
Deputy, again, follow up on the last question I asked. Do you have the names of the 5 top organizations that were giving grants and contributions?
I think what we can do is we'll
I'm asking if you have those. If you had about a half hour or more to look them up, are they available?
Ms. Manso.
No, we don't have that level of detail, but we can provide them to
Thank you. Okay. I went through a bunch of your figures here. Your 2022-23 numbers, it looks like you lapsed some money that was appropriated, it seems. So is it standard practice to appropriate money through this estimates process and then lapse those funds at the end of the year, or let them stay on your books? And how long do they stay on your books for?
Deputy Minister.
So I think what I would say, every kind of funding decision, obviously we have a responsibility through the mains, the SUPs, and kind of good fiscal responsibility to account for the money we spend. I think in some instances where lapses have occurred, it could be things like the Afghan resettlement program, where the pace of arrivals was not quite exactly as predicted in light of situations we felt on the ground. Exit permits from Pakistan to get people in. And that matters to us financially because when people arrive as a government-assisted refugee, the kind of interim housing benefits kick in. And those numbers can be fairly large in the context of our appropriations. So that's how I would explain some of the lapses that have taken place as a result of
So would that amount to about $1.4 billion between the end of the year, last year and this
Deputy Minister.
Sorry,
Give a-
what was the figure you used?
$1.4 billion? What's the
No,
number?
that would not amount for that. So I'll let Nathalie speak to that.
Madam Manso, go ahead, please.
The total lapse was 933 million.
930, so
Honourable
almost
member.
$1 billion. Thank you very much. The bulk of the increased spending you're asking for now, you're asking 184 million in operating expenditures and 475 million more in grants and contributions. Again, these grants and contributions. And this is for, would you explain the grants and contributions to me, please?
Honourable Deputy Minister.
I think the grants and contributions for us as a department is primarily to the settlement and resettlement network. And the totality of that spend over last year was about $1.3 billion. So in terms of the SUPS estimates, I think what you would see is, in light of the extension of the QIT program, that would mean that some of the benefits associated with it, financial assistance, interim housing, language and employment supports, that would be part of some of the grants and contributions that we allocate within the department.
Thank you. Now, we got a difference here between the numbers. Educate me here, please. We're talking about an extra 57 million coming up, resettlement assistance program, increasing 57 million to 329 million, plus contributions. So grants and contributions. Can you explain the difference between the grants and the contributions for
Ms. Manso.
resettlement assistance?
So a contribution requires a contribution agreement with the recipients and may have some conditions. The grants are non-conditional payments to
Honourable
recipients.
Member.
IRB has not requested any more money this year for the Immigration and Refugee Board. Is that because of the closure of Roxham Road, that it is no longer requiring as much to get people through the process? Has that been a net savings and will be a net savings in the final analysis of these estimates?
Deputy Minister.
So I think that I won't necessarily speak to all of the details of the IRB, but I think what I would say to you is that the Roxham Road closure has not led to a decrease in the numbers of asylum seekers. I think that the IRB, as well as other partners in the system, including ourselves, got additional money in past budgets that we're sort of looking at how we can use those funds to match the numbers that we have. But I think I would be fair to say that the volumes have not decreased as a result of the STCA negotiations of the additional protocol.
The Housing Assistance Program, 212 million. The Minister and you both spoke about it. This is extraordinary, obviously, with too many or an excessive number of immigrants coming in at one point in time here without infrastructure to house or provide them with services. Is this something you're going to see lapsing going forward, or is this going to continue on as part of your budget lines going forward?
Deputy Minister.
It is something that we're paying very close attention to. So I think that the interim housing assistance program has been essential in protecting the most vulnerable people from staying on the streets and providing interim housing. I think that as we look at the asylum context around the world and as we look at its domestic ramifications, we are assessing exactly what the impacts would be and also what are the best ways to manage this, outside necessarily hotels. We talked about the reception center. The Peel investment is looking at how we can bring service providers into one space. People can apply for their work permit. People can get some of the social supports that they need. People can have interim housing.
Yeah, thank you.
Honourable
Thank
Member,
you.
you have 40 seconds.
Yes. We talked about, let me refer to the Yates report a little bit here because it melds with something else here. The Yates report indicates that you're going to have to go through an reorganization here at some point in time in the future because you're more or less got a broken organizational structure through no fault of your own. And it says that your employees have done a good job of holding that all together in the meantime. But you're going to need some funds for a reorganization. Obviously, you're also going to need some funds for the digital changes you have to go through, the plan that is requiring it. And yet there are no funds going forward indicated in your go-forward plan. So I look at your budget, your estimates here, and I look at your go-forward plan and the departmental plan. There's nothing here that seems to speak to reality of what you're going to face here in the very near future. And yet it does indicate that you think you're going to reduce your spending. Can you please comment?
It's already 6:15 mark, so please be brief.
Okay, so I would say first, we have done the reorganization and we did do it in a cost-neutral way, but we have listened to the advice of the Yates report and have made decisions as a department, and we are reorganized, and that was effective October 16th. The second point I would make is on the issue of the modernization activities, we have been allocated over, I believe it's around $840 million for the digital modernization platform, and that is what's taking us to what the public procurement has been around a client facing front end and the back end supports we need. Thank you.